Hey, EO Alive. We're glad you're here with us today. And today we're doing the COVID-19 update again with the ladies from CHD. And I really appreciate you guys jumping in. And we always have a great conversation. And thank you, EO Alive, for tuning in. And let me turn down this thing so it's not distracting me. So, how are you guys doing? Have you been out in the sunshine at all? I mean, I know, Elizabeth, you're freezing. You're cold.
I just glanced out my window. I wish the sun was shining right now, but I did have a chance to enjoy it this weekend, so that was nice.
Yeah. How about you, Carrie?
Yeah, I have a dog, so I'm forced to go outside every once in a while, and I'm definitely appreciating the shift in the seasons and really looking forward to some more time in the mountains this weekend.
Yeah, it was beautiful over parts of the weekend, and then I saw a picture earlier today of snow on top of one of the passes, and it's just crazy. So, but here we are, right? The craziness fits in with everything else that we're experiencing and going on, right? So, well, Carrie, we've had quite a bit of information from the governor, and why don't you catch us up on where we're at on that and what's current, and I don't know, catch us up there.
Yeah, so, I think that it's pretty clear to me that folks in Union County, Eastern Oregon, and across the nation are really eager to move into the next phase of our response to COVID-19, which really means starting to get back to some of the normal activities that we were engaged in pre-COVID-19, and that would involve reopening our state and relaxing the social distancing orders that have been put in place by our governor. I think over the last week, you can see that there have been a few that have changed. I know just yesterday she made a move to reopen some of our state parks. So I think that there's slowly some steps that are moving in that direction. I know that a lot of our Eastern Oregon counties, including Union County, have been working on their reopening plans. And last week, the governor came out with a specific set of prerequisites that all of the counties in our state will need to meet in order to reopen. And so I know that our county is diligently working on making sure that we have all of those prerequisites ready and in place and ready to go to send off to the governor to let her know that we are ready to move into the first phase of reopening. I know that there's been a lot of work that's going on behind the scenes to develop guidelines for different sectors of business and our society that really help us kind of reopen our businesses, reopen our social services, reopen our communities with guidelines that will help us mitigate the transmission of COVID-19. I think it seems like so long ago that we were talking about flattening the curve. But as we move to reopening, what we need to do is, again, make sure that our capacity to treat and respond to folks that have the disease doesn't go beyond what our system can handle. So we are going to incrementally be working on steps that will take to keep the disease transmission low while being able to start doing some of the things that we have been putting on hold for a while we get things, we learn about the disease and we try and learn about how we can keep our community as safe as possible. From a public health perspective, there have definitely been some changes over the last week in our guidelines that we use for investigating COVID-19 and our testing criteria changing. So there's, again, a few little steps on the public health side that we're taking to prepare for the next phase of this process. So I think we're still learning information from OHA. And again, we're just doing what we can with the information we have now to get ready and respond. So the minute that we're able to take that next step, we are ready to move into that phase.
Great. So when we reopen, kind of talk about, are we going to see more cases? How do you think? And I understand, I guess I'm talking about on a local level. What is your thoughts on how reopening will impact us on a disease from a disease standpoint?
I think that it's very likely that we see more cases in Union County as we begin to reopen, simply for a couple of reasons, actually. We are working on expanding testing. That was one of the pillars of capabilities that we need to be able to uphold to be able to move through the reopening phases. So expanding testing guidelines, the more you look for a disease, the more you're going to find it. So that in and of itself will probably lead to more cases. And the more that people begin to mingle and lessen their social distancing practices, physical distancing rather, the more the disease has a chance to be transmitted from person to person. The more surfaces we touch and the more people we share air with, the better the disease is going to be able to move around. So it's pretty likely. Of course, I wish I had the crystal ball, but we are definitely making sure that our capabilities are in place to be prepared for those cases going up.
And and at the end of the day, that is the whole purpose of this quarantine life that we have been in on, what is to flatten the curve. And I have mentioned this before. Anybody, if you remember 8th grade math, flattening the curve does not change volume. It changes the rate that and in this particular case, it's the rate of people that go to the hospital. And at the end of the day, that still is the purpose, is to not overwhelm our system.
Absolutely.
Yeah. But the real life scenario that some folks, that most of us are going to be facing is, are we so unhappy with this quarantine lifestyle that we have that we're willing to take more risk of getting the disease? And I think that's a real live question that people are asking, and that's a real live question that people are going to be acting on. Do you guys have some way you want to respond to those folks that are saying, well, I guess I'm willing to take a risk?
I think one thing that I would...
Go ahead. Go ahead.
One thing that I would like to share is what the Carrie mentioned, the new investigation guidelines that came out from OHA Friday, and how contacts and how investigations have gone prior to the reopening phases looks different than how it's going to look going forward. And so a couple of things that I think that are really important for the public to understand are the definition of being a contact to a confirmed case and what we do with that information. So just to briefly overview my job as a CD nurse and conducting the investigations, the person who tests positive, it gets a lengthy interview about everywhere that they have been since 48 hours before their symptoms started. And with the new investigation guidelines, the definition for a contact is anybody who was around a confirmed case for 15 minutes or more within 6 feet, starting 48 hours before they exhibited symptoms. So what we do with that information is, using those investigation guideline updates now, we are required to contact all of those people that fit that definition as a contact. And those people are going to be asked to remain at home for 14 days, which is the incubation period of this virus, and participate in what we call active monitoring, which means we will check in with them once a day. They will be asked to take their temperatures twice a day, and we'll be monitoring their symptoms very, very closely and testing them. So what that implication has on the public is, weighing out what that means for you. If you are going to go to a really high volume store or barbecue or somewhere where you could be exposed to a lot of potential, then, is that something you're comfortable with? Are you, what does that look like for you? Are you equipped to stay home for the next 14 days, and financial implications of that, etc. So I think that that's really important for the public to understand. That going forward, our focus is going to be really on identifying those contacts, putting those contacts in active monitoring at home for 14 days, and testing them, and making sure that they are cleared to go back out into the community. So.
Okay, Carrie, you have anything you want to add to that?
Yeah, I mean, I think that Elizabeth touched on what risks are we willing to take, and I think those are really individual. And I was just thinking about this myself last night. I'll get a little bit personal here. I have a daughter who has asthma, and it's definitely a concern for me. I think that it would be really scary as a mom to have her get that, knowing that it could affect her more significantly than anybody else. So I've been being really cautious for that reason, and because I know if I were to get sick, it would be very hard for me to parent my kids. It'd be very hard to have a very serious, severe illness and be able to take care of my kids and also do this job that I've been doing. So, I've been really thoughtful about what I do. And it's like, yeah, I need to go to the store and get food. So I'm definitely taking that risk. It's a risk that's worth me taking. But there are other things that, I may have an opportunity to do that I will be a little more cautious about. And I really do put it in those terms of like, is this worth taking the risk that we could get exposed to the virus and have that outcome? And I think for some people, there are definitely going to be many things that are worth taking that risk for. And I totally get that. And I think for me, I'm just choosing to be more cautious because there are certain things that aren't worth the risk. And I do think everything I'm going to do, I think about it in those terms. I also think that, the reality is that part of our actions, they do affect people around us and people in our community. And so I do also think about that too. Like I am, I could be healthy, but I could asymptomatically be carrying the illness, and I could go around other people and I could put them at risk without even knowing it. And so again, I do try and think about it both in terms of the risk to myself and the risk to those around me. And I think that as we move into this next phase, of course, yes, we're going to be going out more. People are going to be in more situations that are going to place them or their family members at risk. But I think it's worth, asking those questions as we go forward, both for ourselves as individuals, for the people in our, our families, our friends, our neighbors, the people around us that we really care about and we want to keep safe and healthy. And then also for our community, for those reasons that we talked about before, if we continue to exercise caution, we take things slowly, it will help us move on to the next phases of the process, because there will be phases in this process. And I think it's important for the community to know that if we get to a certain threshold, we could go backwards, and that we could, lift social or social distancing restrictions. And then if we had a significant increase in cases or something changed, we could have to go back. And so I think, this is a way for our community to help support us getting to the outcome that we want. So, yeah, and I think the other thing that, I usually start these talks out by talking about the situational status, both in the state and our county. And I think that, we've been really fortunate that we haven't seen a large number of cases in Union County. I think that obviously we've done a good job of keeping the transmission low. We haven't seen a case for quite some time come through. But I think that we're also noticing that there's activity happening beyond Union County. And so we're paying attention to that. And, again, diseases don't understand geographic boundaries. I've probably said that many times before on this program. So again, just wanting to make sure that we're paying attention to what's going on around us and keeping that in context as we move into the next phase.
Excellent. Thank you. So Elizabeth, a follow-up question from Facebook. Jason says, why would you only want to know contacts for the last 48 hours prior to symptoms if you could have been contagious for the last 14 days?
Oh, so that's a great clarifying question. So what I was trying to communicate is that the contact investigation starts 48 hours before symptoms, and it goes through all the way through the time that they test positive and they start isolating at home. So great question. It's not just the 48 hours before. That's when it starts. Because we know that people shed the virus before their symptoms start. So that's when we would look at somebody's timeline and daily activities is 48 hours before they became symptomatic, all the way through the time that they test positive and get home.
So to boil that down, make sure that I understand. So then let's say somebody, they're tested positive for having COVID. Mm-hmm. And then you begin to ask them questions and say, so who have you been with the 48 hours prior to your first symptom? Is that okay? So, yep. So you started to cough 2 days ago, and now you've been tested with having COVID. So that 48 hours before you started to cough, we need to know everyone that you have been in contact with, that you have been closer than 6 feet for longer than 15 minutes.
Yep.
Okay. And you've got to have the names of all those folks. You've got to follow up on those folks. And you're going to ask every one of those people to quarantine themselves for the next 14 days and to comply with being checked in, have their temperature taken, and on all of that stuff. Did I miss anything?
Nope. That's absolutely correct. So
okay.
As you can tell with that, those are some really big asks. Those
right.
are some really big asks.
Right. So those are, yeah. So those are part of the inconveniences that you might face as you start hanging out with folks. Yeah. So, but if they say, well, yeah, I went to a barbecue, but we were never closer. I didn't touch anyone. We were never closer than 6 feet to each other. Yeah, we hung out and drank beers for an hour, but we were very careful about it. That would comply, correct?
It would. Yeah.
Okay. And I'm sorry, I'm asking the question like a teenager. Like, okay, Dad, so if I do this and I do this, but this is real life. I mean, these folks are making these kind of decisions, and the best that we can, I want to help them make those decisions.
Yeah, I think, the 4 cases that we've had in Union County and the investigations that I've completed with those cases, when it's natural behavior, it's natural human behavior to think this is going to happen to everybody else but me. I'm not going to get this. This doesn't happen to me. We think that way about all sorts of things. When somebody actually gets a positive test result, they genuinely care about the people that they are with. If you're going and hanging out at a barbecue and drinking beer with your buddies for an hour, you care about those people. And sure. that comes out in those interviews. I mean, we build rapport with the patients. It comes from a place of caring. It's not punitive. It's not trying to invade anyone's privacy. It's, hey, how can we help your friends, family, loved ones monitor their health status? Because everybody has somebody in their circle that is a vulnerable person, one of those high-risk people. None of us wish ill on our loved ones and our friends. So, yes, technically that would comply. I think Union County will think about it and do what's right.
But the bottom line is the physical distancing aspect of it is still important to keep in place.
It's important to keep in place. And I think it's also important. One thing that, I obviously don't write the investigation guidelines, and the people who do are very, very equipped to do so. These are experts in this field. One thing that always bothers me when I read those timelines or those investigation guidelines is that surfaces are not addressed. And they're not addressed because it would be impossible to follow up on. But what's the likelihood that you go to a barbecue and you don't touch the tongs or reach in the bag of buns or fiddle through the stack of paper plates to get the one off the top? I mean, contact with surfaces is just as important as sharing the air within 6 feet. And so, although it's not something that we use specifically to elicit the contacts because it would be impossible to do such, I think it's really important for people to keep in mind that it only takes one touch on a surface, going to the bathroom, setting your cell phone down on a kitchen counter, for you to take it back home to your family. So.
Okay. Thank you. You want to add anything to that, Carrie? That part of the conversation?
Yeah, I'll just add, I've been thinking about it a little bit, and it's like what we're doing now is we're going to give people an opportunity to kind of go back to normal, resume, their normal lives incrementally. Obviously, we're going to do this in a phased approach, and we're going to take steps. And I think, this new approach to investigating, asking people to stay home if they've been in contact to a case, I think the reality is that we know that those people do have a concrete risk. They're either sick with the disease because they have a positive test result, or they've been in contact closely with somebody that had a positive test result. And so again, there's a real concrete reason why we're concerned that they may have or be at risk for developing the illness. And so we're really going to ask our community to help keep it at bay by, staying home if they're sick, or staying home if they've had a significant exposure or a risk. And so, again, as I think about us transitioning toward the outcome that we want, which is to not be having to stay at home all the time and to reduce these physical distancing requirements and, to be able to lighten things up a little bit. This is a real concrete mechanism for us to get there. And this is a way that people can help get to that outcome that we want as a community.
Good. So, Carrie, talk about, for people that might not know, talk a little bit about what hoops, in a brief kind of a way, what hoops the county has to jump through in order to fulfill the requirements to open up, just so that give them a sample of what the governor is requiring. And then also that if for some reason cases increase, how some of that restriction could be reapplied. Talk about that a little bit, if you would.
Sure. I'll just give a high-level overview of the prerequisites that we're working toward accomplishing, or at least demonstrating to the state that that we have in place before we move into phase 1. So, obviously we're looking at the prevalence of COVID-19. So this includes emergency department visits and hospital admissions. We're looking at minimum testing requirements. So the state really wants us to have a certain level of testing capacity throughout our region to be able to meet the testing requirements as we move into the next phase. The contact tracing system that we've been talking so much about, that's another component. We need to make sure that folks are able to isolate if they need to. So we need to arrange places for people to stay if for some reason there wasn't a place. This one is probably a criteria that's more relevant for some of our larger communities, but it is on the list. The sector guidelines that I referenced, so the criteria for different sectors to help them mitigate the spread of the disease in their various facilities. So, like businesses, employers, restaurants, different sectors. And then their healthcare system capacity is another one. So, just making sure, again, that our hospitals in our region are able to handle an increase in cases if we have that when we reopen. And then personal protective equipment is also another one. So those are kind of the prerequisites. Like I said, Union County's been working on this for quite some time. We really do have most of the things in place and ready to go. It's just a matter of, working on submitting them in a way that meets the governor's requirements. And then there are a few that will involve some, looking at data on a regional level. And so again, we're working with OHA, we're working with our partners in the region, and kind of getting everything together so we're ready to go when it's time.
Great. So Elizabeth, the CDC and OHA have added presumptive cases.
Mm-hmm.
What does that mean for us?
Yeah, so the presumptive case definition was something new that was added to the investigation guidelines that came out on Friday. And what presumptive means, so prior, we've been reporting just confirmed cases. That's somebody who has a positive FDA-approved test. Presumptive cases are now a way for us to capture the cases, the patients who are symptomatic with COVID-like symptoms and have been in contact or identified as a contact to a confirmed case, but perhaps tested negative or maybe didn't test at all. And some examples of this would be our prior case investigations and really focused on household contacts to the cases. And because prior testing capabilities were so limited, we weren't actually testing the household contacts because if they were symptomatic and they were living with a confirmed case, we assumed that we treated them as if they were positive. Now we have a way to capture those cases. And what that's going to do is it's going to be able to help us keep a better understanding of the disease prevalence in our community. And it also helps account for, right now, our test has a 30% false negative rate, meaning 30% of the people who test negative are actually truly infected. And so again, that helps account for those people. So instead of prior to these investigation guideline updates, we would just count them as not a case. They were nothing. And so now we have a place to include them in our data and be able to take the next steps to help educate them and help them stay at home.
Good. And the reason that matters, correct me if I'm wrong, the reason that matters is because if you look at Union County, you say, well, we only have 4 cases. Well, the reality is we have a lot more than that. It's just some of those folks have moved through the disease. They were, they had a fairly mild case. And so, or maybe they moved through it and they were in bed at home for a week and we just don't know. So,
right.
And that gives us a better picture of the seriousness of the disease. And then also, it reinforces this thing where you presume that everyone that you know might have it, and that's the way that you approach that relationship with them. Did I get that up? Did I summarize that good?
Yeah, you're right. So the reason we can only say that we have 4 cases is because the case definition for a confirmed case is very specific. And so although we've had people who have been very sick and either were not tested or tested negative, even though, every clinical feature and sign and symptom that they had and other studies showed that they were very likely to have it, we couldn't call them a case. But we know that we are confident that they do and they need to be treated as such. And so, we hear all the time in public health, well, we only have 4 cases. We only have 4 cases in Union County. And, we only have 4 cases that meet the confirmed definition. But we don't just have 4 people in Union County that have COVID.
Good. So a couple of quick questions. Holly asked, when will the city parks open? And that's totally outside of any of our purview. Let's see. Somebody asked when. Judy asked, when will phase 1 happen for Union County? Do you think, Carrie, have a guess on that?
Well, I can tell you what I do know. It was very clear. Governor Brown did hold a press conference last Friday. It was very clear in her statement that the soonest we could expect phase 1 to occur in any part of our state would be May 15th. I feel like at this point, I don't know that we can 100% count on that being the date. As I said earlier, we're still waiting really specifically for the details on how we submit the plans. The exact timeline and dates are still honestly to be determined. So I think we're just continuing to wait. And of course, when that information is available, I can't say we at CHD will be sharing it, but I'm sure that our Union County Emergency Manager and the incident management team at the county level will be informing our citizens once we have more information.
Good. And then, Carrie, you might not know this right offhand, but how many people have been tested in Union County? Do you know what that most recent number is? And I know it changes. And if I remember right, we don't know necessarily those that have been privately. We don't have a number for those that have a private test with their physician, meaning they go to a doctor and the doctor does a test. We don't, the numbers that we have are the ones, I don't know, just speak to that if you would.
So I just looked on the Oregon Health Authority website. It looks like we have their reporting 148 negative test results along with the 4 positive test results. I think that there was a period of time where we weren't confident that all of the negatives were being reported out on the Oregon Health Authority website. So I'm not sure if that's been corrected. And obviously there could be some pending results right now that wouldn't be reported on there because they were still in process. If Elizabeth has a different picture, she could certainly chime in, but that's the numbers that we have publicly available today.
Yeah, I would say that those are, I would say that that's a lower number than reality. We were having, as laboratories, private laboratories came online with COVID testing really fast, much faster process than normally expected. The computer systems within those private laboratories that report to the state database where we get all of our electronic lab reports, we're having quite a bit of technical difficulties early on, and we're still sorting out and trying to go back and reconcile and make sure that we've captured all of those negative test results. And I'm not confident that we have. I think that there are still quite a few that are not being reflected on that count number.
Okay. Well, hey, thank you. So let's get ready to wrap this up. But I have one question, and that is for businesses. So in preparation for this, businesses eventually to open with some kind of a restriction or so on and so forth, do you have, Carrie, do you have some, do you have some, what are some of the things that businesses can begin doing now to prepare for the load, the requirement load they might have to do once the governor says, okay, you can reopen? And I don't know, give me an idea of how businesses can prepare for that.
Yeah, I think it's going to be really hard to prepare without having a clear idea of what the different guidance for different sectors will be. I think you have to remember that what we're doing is we're encouraging changes to environments to reduce the risk of spread. And so how you change an environment really depends on the environment, right? So, restaurant may be different than a childcare provider as a good example. Like the type of setting really will dictate the measures that you can realistically put into place to mitigate exposures for the employees and the patrons. And so I think that one thing I would suggest that everybody do, and I think this applies to individuals as well as businesses or any sector in our community, is really like sit back, look around, say, okay, these are the possible ways that somebody could come into contact with the virus in this setting. So, the commonly touched surfaces, the places that people are sitting or interacting, really looking at the environment and saying like, okay, well, if I were to put regular cleaning into place for my doorknobs, for example, and I were to set it at every 15 minutes, I was going to go wipe the doorknob off, and I create a log or something like that. I mean, again, this is a really maybe not going to be at all what people are asked to do, but I think, again, as a business owner or even as somebody in my home, like there's no harm in me looking around and seeing if there are places where I could try and reduce the spread of the illness. Obviously, if you're a restaurant, you may want to think about how you have people seated in your facility. Is there a way that you can increase spacing between tables? I expect those are things that probably will be recommended. Until we have the final list, we don't know. But I think, again, just really looking around at your environment. And, I also think about part of this will be, in my mind, a change in our culture around supporting people and staying home if they're ill, and really just encouraging people that are sick to not go to work. I know sometimes that can be really hard for a variety of reasons, but, again, really just thinking about the ways that we as individuals can take actions, and then we as a community can support reducing the spread of the disease. But I suspect over the next week, there will be definitely more concrete details coming out that will help businesses really think about the steps they can take as they move into the next phase.
Great. All right. Well, thank you, ladies, again for jumping in today, and great conversation. And we just kind of all hold our breath until we get to the next place and continue doing the things. I mean, if I do not have a retail business, but if I did, I would look around and go, well, giving all of the recommendations for me personally that I've been going through, how could I imagine my business needs to adapt to accommodate those things? And there are just some things that would kind of make sense. So, yeah. And I think, at the end of the day, I'm sure there's a lot of business folks out there. It's like, don't tell me no, just tell me how. They just want to know how to get through the hoops in order to be serving the customers and having some income coming in. So thank you, ladies. Any last words?
Thank you.
No,
all righty.
Appreciate the time.
Yeah. All righty. Hey, thank you, EO Alive, for tuning in, and we'll see you next Wednesday at 1:30. Thanks again.